Fiambalame, fiambalame. Apa makananga, kachengele katika. Utim nakome, kachengele katika. Nanga kayuni, kachengele katika. Kakuti uli, kachengele katika. Sachisoni, anzanga, simenenda ona.
Before I knew that I was HIV positive, I was getting sick on and off. So I went for HIV test so that I should know my status. So the doctors said that since this one is having tuberculosis, her CD4 might go down very soon. So they started giving me ARVs. After that, my life has changed. I'm doing everything. I can work, I can run, I can dance, I can do everything that a person, like any other person who can do anything.
Healthcare is important because it's only health people who can contribute positively to national economic and social development. It's a human rights issue. Every person has got the right to access quality medical care whenever he or she needs it. The challenges for the healthcare system are too numerous to mention. We have inadequate infrastructure and also inadequate medical supplies and equipment. We have inadequate trained medical personnel versus the number or the population of our country. That is resulting in a brain drain. The skilled personnel are flying out of the country to seek for greener pasture because they are not maybe well paid. It's also one of the challenges.
In our hospital, we are 2 qualified medical doctors, and we have to see almost 800 patients in a day.
The workers are just a few. The services are delivered, but not too adequate because of the shortage of the staff.
It is overwhelming to see a very big number of patients who are to be attended to, or whereby we have very few health workers.
Fiambalame, kachengele katika. Fiambalame, kachengele katika. Panji mkakana, kachengele katika.
This is our labor ward where we conduct our deliveries. We have got 3 beds for 3 women. But it's a challenge sometimes because we have got more than 3 women at once who can deliver. So some are done on the floor.
The main challenge of having HIV is that a person knows that I'm HIV positive. Though we know that everybody will die, but a person who is HIV positive has more risk than a person who is HIV negative.
From 2006 up to 2010, we have seen improvements in maternal health, child health, and also in HIV and AIDS. So the Deputy Constellation has improved this health service delivery in Malawi.
It seems we're still in the bad state. Not much has been done in improving the healthcare system. The issue of access at community level remains a big challenge, and also the issue of human resources, and the issue of infrastructure. So I can't say we have made any progress since the data cancellation was done.
However, within the free service delivery, there are challenges For example, shortage of drugs, a shortage of personnel to offer the services. So the human rights issue are partly achieved.
We need more resources so that we can improve on infrastructure development. We can also improve on supplies and equipment.
The best thing is that if the government can train more healthcare workers so that the services should be delivered fully. The problem of funding from the government.
The debt cancellation, of course, it was a great honor to us as a country, but we still have a number of gaps to be addressed.
Yes, I have a dream in my future. Since I'm taking ARVs, I know that I'll see my grandchildren and I will live longer and healthy.
Debt repayment is not fair if the social services are not there for the people of Malawi. Can't pay, won't pay.